On my phone, it doesn't use. Is it hour?
Mhm.
All right.
Hello.
Hi.
Hi. Panelists and attendees. I see attendees are coming in. We will be starting here pretty soon. I'm gonna let everyone load up. I'm glad everyone's early. I will start exactly at 6 because I know we have a lot going on. So just bear with us and get some paper out.
Hey, everybody.
Hello. And to the students that are in the participants section, obviously your videos are off, but your chat will be on. So you can use the chat function. I'll describe that a little bit more. And we'll be getting started here again very soon. I got my phone in front of me, 5:59. I'm all about starting on time. So we will start exactly at 6 whenever it turns over. All right. Oh, turned over to 6. So I will give a little brief introduction and then we'll go through and allow our panelists to introduce themselves. Thank you for everyone that's coming on and welcome to the Emergency Medicine Residency panel. This is a collaborative event between the Latino Medical Student Association, the Student National Medical Association, and Tour for Diversity in Medicine. Before I get started and get into a little more, as I'd like to put it, formal introduction, I would like to thank all of the faculty that are with us and all of the students that are with us. I truly appreciate it. There is a lot going on in the US today. We have unfortunate protests, there are shootings, NBA games are being canceled, there are national conventions, and lo and behold, just throw in a hurricane to those in the Gulf Coast, excuse me. But to everyone who made it here today, we promise it will not be a waste of your time. We thank you for sharing your energy with us, and we will be keeping it as positive as possible here. So moving forward, the purpose of this panel is to provide expert advice to the fourth-year students of LMSA and SNMA to improve the underrepresented minority representation in emergency medicine during the tumultuous times of the COVID-19 pandemic. The reason we're so specific is some of you may be wondering, why wasn't this done before? Obviously, it should have been, but during the pandemic, we wanted to come together and make sure we gave a product to make sure all of the members of these two illustrious organizations had a better chance when getting into emergency medicine. I will put this out there now as I've gone through the registration list. The main focus will be for fourth-year students. Obviously, all of the advice can trickle down to 30 years or to anyone else who's graduated, but that will be the main form of our focus. But we will be allowing questions and answering other people who are applying into the emergency medicine category, whether they're graduates or again, MS3s. So my name again is Lebanani. I will be your moderator for the evening. I'm a former parliamentarian and Speaker of the House for SNMA, and I am currently a mentor for the Tour for Diversity. We will be going in order and introducing ourselves. As you can see on the screen, I'm double checking all our panelists. I think I'm missing Dr. Dreyfus for right now. So we will go ahead and skip forward. I will let each panelist introduce themselves in the order as you see on the screen. Go ahead and say if you've done anything within LMSA or SNMA and where you're currently practicing. Please go ahead.
I'm Dr. Amir Hamid. Can you hear me okay? Yeah, I'm Dr. Amir Hamid. I'm one of the core faculty members at John H. Stroger Jr. Hospital in Cook County, also known as Cook County Hospital. I'm also the assistant medical director for the Chicago West EMS system. And I was very involved with SNMA as a medical student, all 4 years of medical school.
Thank you very much. Dr. Lord, you can introduce yourself.
This is for me?
Yep, this is for you.
All
Go
right,
ahead.
prime time. My name is Keto Lord. I am the medical director at University of Tennessee Health Science Center here in Memphis. You know, I think one of the things that, you know, SNMA and things like this do is it helps to provide a lot of perspective. I'm initially from Philadelphia, ended up going to Morehouse as well as Howard, HU, and then ended up going to Yale Residency. I'm currently core faculty now, and we are year number 5 of our residency program here in Memphis. So happy to answer questions going forward.
Thank you very much, Dr. Lord. Dr. Uribe?
You guys hear me now?
Yep.
All right. Hi, all. I'm Jeffrey Uribe. I'm one of the emergency medicine attendings at Montgomery Medical Center, part of the MedStar system here in Maryland and DC, part of the Georgetown University Hospital and Washington Hospital Center Emergency Medicine Residency. I went to school in North Philadelphia, Temple University, did my residency in South Bronx, and then I did a year of EMS fellowship, formal president of LMSA during med school, as well as regional co-chair of the Northeast for LMSA National, and then went on to become chair of National Hispanics Medical Association for the Council of Young Physicians, Council of Residents.
All right. Thank you very much. Dr. Alvarez, if you'd like to go ahead and introduce yourself to everyone.
Yep. Hi, my name is Ellie Alvarez. I'm one of the assistant program director at Stanford. My main focus is on process improvements and diversity, equity, and inclusion, and also physician well-being. I'm also the co-chair of our physician wellness forum. I've been involved with the SNMA over the past about, I think, 3 or 4 years with our SCORE program, with recruiting students to rotate with us here in summer programs at Stanford.
Thank you very much for representing the West Coast. I know it's still early over there. I'm sure the sun's still shining. Dr. Bradby, if you'd like to go ahead and introduce yourself.
Hi, everybody. My name is Cassandra Bradby. I am the Residency Program Director and Vice Chair for Diversity Inclusion at East Carolina University in Greenville, North Carolina. As a graduate of Meharry Medical College, like all of us, I was a member of SNMA throughout my 4 years in medical school, and now I serve, I'm in year 6 of being the SNMA advisor here at Brody School of Medicine.
Awesome. Dr. Pierre, if you'd like to introduce yourself.
Yes, I'm sorry, my video on off right now.
Okay.
But my name is Pierre. I'm a 3rd-year emergency medicine resident at Brickell Hospital Medical Center in East Brooklyn, New York. I was involved in MAPS while I was at Xavier University of Louisiana. And I was on the board of directors for SNMA during medical school at Creighton, and then Howard as a co-chair for the Health Policy and Legislative Affairs Committee for 2 years.
Excellent. And last but not least, Dr. Lepete, if you'd like to go ahead and introduce yourself real quick.
Hi, I'm Helene Okperi. I am a current PGY1 at Emory in Atlanta, Georgia. I am a graduate of Morehouse School of Medicine as well. At Morehouse, I was a proud member of SNMA and helped to organize the conference that was in Atlanta. And I'm just happy to be here, and I'll just be answering questions in the chat.
Yes. So if everyone can see on the screen, you see that we have 4 chat moderators. The reason being is we knew we were going to have a lot of students and a lot of interest. So students, feel free to drop any question you like in the chat, whether in the Q&A section or directly in the open chat. Our chat moderators will be answering them directly, as well as myself. I'll be pulling questions that I'd like to answer live with the panel up first. I do have 10 questions, excuse me, already pre-drafted. But one of the things we wanted to do here, this may sound corny, we wanted to keep it very real with all the students. So I only pre-drafted 10 questions, and then we much prefer to answer all of the questions that you guys have out there. So we will be doing that. So all of our chat moderators, please go ahead. You can switch your videos off if you'd like, and then we'll go from there. Let me move forward very quickly. So real quick, we wanted to show this information of why we're doing this. So you can see in the red box, emergency medicine had a total of 2,665 positions. There were 2,652 filled. So there were 13 open positions across 7 programs. You can see the vast majority were MD seniors. Then there were 683 DO seniors. But you'll see there are some MD grads, 43, and DO grads, 28, who didn't match into EM in 2020. Those are people who already graduated in 2018 and were reapplying for the 2019-2020 cycle. Moving forward, you can also see that US IMGs did have 155 people who matched, with 30 non-US IMGs matching. That's US citizens who went to an IMG school. So why are we doing this? You can see the underrepresented minorities in emergency medicine was a paper written by some, what I like to call giants in EM, including one of the T4D creators and co-founders, Dr. Landry, and they looked at how well are we doing in emergency medicine. I will skip to the end like a lot of people do and just show you the results. URMs comprise 30% of the total US population in 2013, yet only 6% were practicing physicians, 9% were EM physicians. By comparison, there were 15% of medical students, 17% of all residents, and 14% of EM residents. So as you can see, that's woefully low in comparison with the full population. So in conclusion, like a lot of other specialties, diversity was lacking. And we're hoping that this panel can help fix a lot of that. So I will stop sharing my screen now. We will go back to our panel. I see the questions are already flowing, so feel free to answer those, moderators, and I will go and start with the questions that I have here. So the first question that I had for our group was, what changes to the interview process has your program or department made during the pandemic to facilitate virtual interviews? And anyone can feel free to answer.
This is Amira from Cook County. So our program, actually our residents have really jumped into trying to recruit heavily through social media. So our Instagram page is filled with videos. They're doing this thing called Life of the Resident, or a day in the life of the resident. And one of our residents from whichever year will take over the Instagram account for a day, and they'll take you through their rotation. So you're seeing how it is. You're able to look at the hospital, look at the things that they're doing throughout the day. And we're also doing a lot of panels. So over like last week and then next week as well, there are 4 panels. There was one panel with like the program director, another panel with women in emergency medicine, another panel for URM residents, et cetera, so forth, just to kind of give people a feel of our program. And those videos are saved up on our social media platforms. And then we're also participating in a lot of panels like this one, just trying to put our face out there and get to know people, get to know applicants, and have applicants get to know us.
Yeah, I would love your thing is muted for a second.
Thank you, go ahead.
Yeah, no, we're doing a lot of the same things in terms of social media, and I think the trend was moving that direction anyway. It's kind of been full thrust at this current time. So social media pages, Twitter, for instance, as well as Instagram, Facebook pages, so you get a better idea kind of what goes on in the residency program. I think also just facilitating the Zoom conversations. I mean, I think it'll be different for not only the attendings interviewing, but also for the applicants. And so it changes the game. And so I think if you guys have had enough Zoom meetings, you guys have seen some things that could go wrong. So you definitely want to make sure you sign in early. You want to make sure that you've prepared and prepped. You want to make sure that you have your phones, you're on a Wi-Fi network and not using your cell phone. You really want to prep really, really well for these Zoom meetings that will be going forward for the interviews. So just keep that in mind when you're thinking about, don't take it cavalier and say, I'm going to sign on and take it from there. It's really important that you prep for an online meeting as opposed to the in-person, which is very different.
I think, Love, I think you're muted. I think to add to what everyone is saying in regards to Twitter, we're trying to get our names out there. We're trying to definitely show our program off so you guys can learn a little bit more about us and how unique we are. We're trying to not change much of the interview process despite it being not in person anymore. So we're trying to do pre-interview dinners with residents. So you're in a Zoom meeting with the other medical students that are perhaps going to interview the following day. And it's an opportunity for you to ask all the questions you can or chat individually with certain residents, whether it's an intern that just started or a third year or fourth year that's just about to finish. And then in the following day, we'll get straight to the point in your interview with several attendings, faculty, in addition to one resident.
Well, that's really good that you guys are keeping some semblance of normal for all of the students, because I know normal is not what we have right now. So question 2, and this is a big question, and if any of our chat moderators like this question, feel free to drop your answer in the chat. How is your program/department handling SLOs or SLORs, whichever acronym people would like to use for standardized letters, during this interview cycle? Some students have had some concerns that they cannot get 2 or even 1 of these standardized letters. And I will have Dr. Uribe, you're in the right corner. If you can answer that question, if you know it all, and then Dr. Hamid, you can go second.
So from the perspective of students here at Georgetown, I know that we're trying to combine and have a consensus SLOE, in addition to any faculty you have worked with, to ask them if they can write a SLOE. So, I think particularly in the world of emergency medicine, we like to see other faculty from emergency medicine, detailing a little bit about your experience and how you performed in the emergency department rotation. And so, we understand the current situation of COVID, and unfortunately, but we also are amendable to, if you have faculty within the rotation that you've done at your institute, some hospitals and programs and schools are still allowing a rotation. There are programs throughout the nation where it's kind of like a virtual health rotation in itself, where you come in several days, several hours, during your rotation, and there's a virtual aspect to it. So we understand that, and if you are able to get a SLOE from that, we'll take that into consideration as well.
Thank you, Dr. Hamid.
So here at Cook County, we're asking for at least 1 SLO. As far as, so the question, and preparing for this panel, I asked a couple of my co-faculty members how they would be looking into the SLOs. And, I think that we really don't know until they hit our desks, because some may look at them a little bit more critical, thinking that people are being more lax when writing these SLOs. Some are probably looking at them with more leniency, understanding that, the medical students have only had 1 rotation to prepare, to get this SLO and to, skyrocket them into emergency medicine. So I'm on I'm going to look at it more lenient side of things. And I think that a lot of our faculty members, we'll keep that in mind. We all know that it's definitely a tough time, and that people won't be able to get 2 or 3 SLOs. One thing that I did as a medical student is I only had 1 SLO, and I think at that time there was like a 2 SLO requirement. So I actually went up to the coordinator, brought her some donuts, and I asked her to switch my shift so that way I can work with the program director, and I got a shift letter from the program director, and I did fairly well in that shift, and that definitely helped me throughout the interview season. I say that because being from, if you are a URM from a school that does not have a, emergency medicine rotation, just use whatever avenue you can use in order to, put yourself in a good position. I do think that getting a letter from someone that you worked closely with, that you worked well with, that can speak to your ability is better than getting a letter from a big name that will just give you a dry letter. So that is one piece of advice I can give.
I'm taking notes. I don't know about everybody else, and I just added donuts to mine. So I'm just throwing that out there. Dr. Lord, if you'd like to say anything.
Yeah, so we're requiring 1 SLO. I think we're all understanding that the pandemic has changed everything. And I think this also might put more emphasis on other aspects of the application. So again, your transcripts, I think your letter of recommendations, as well as your overall personal statement, and also the interviews may carry additional weight too. So, just being aware that the SLOs you may have 1 SLO, but that might up the ante for the other components of your application. And so just be aware that those other things may become more important.
Just to piggyback off what Amit said, for those that are in medical school or DO school that don't necessarily have an EM rotation within their institute and have to usually rotate outside within the nation, or for those that are international, Lord said as well, having that 1 faculty write a great letter of recommendation and it can speak of you, and whether it's months or years of knowing you, speaks volumes of, instead of just reaching out to some faculty that you perhaps worked a couple of shifts with.
Very, very great information there.
And I just want to piggyback on that too. If you could find somebody that you think that you might want to write a letter with, definitely try to swap your shifts, put your attention in. Like when you first start, say I have a good rapport with this person, I think I'm going to ask them for a letter, continue to build that relationship as opposed to retrospectively look after your rotation is done and say, oh, I need a letter. If there's one individual you're working really well with, continue to work with that individual and then ask them for that letter.
Great advice. Okay. So far, I'm 100% sure we have a great panel. I was 99% before, but y'all are dropping gems. So now I'm up to 100. Second question, and this was teased a little bit in the Q&A section. And I know a lot of students will be looking towards this one. For those students who believe they don't have a stellar Step 1 score, what is the best thing they can do to make their application shine or stand out? And I will let each of you you can use whatever number you would like to use for stellar. And I'll start with Dr. Lord because he went last in the last rotation. So we'll start with you and then rotate back.
I mean, there's plenty of things. And I think that's the one, I think what we sometimes underemphasize is or doesn't get appreciated is, your personality plays a large role. There is a subjective component to this in EM, and you can really maximize your points on the subjective component. I think having a story or a background that's consistent, who are you as a person? I think also talking about what you will do as opposed to what you want to do is important. So if you're in the community service and you have nothing in your CV that talks about community service or don't do any programs or anything like that, it's not a good story for yourself, right? And I think that being consistent with that is really important. I think obviously, rocking out your sub-I, your rotation, that's really important. Understanding extracurricular activities are also really important as well. Staying in touch with people, even the residents, and just showing that interest. Those are some of the soft things that you could do to show that you're a holistic person. And then also, if your Step 1 is low, we love to see improvement. I think it just shows dedication. There's nothing but a great story of somebody with a lower step score, and then they skyrocket with their Step 2. That's always reassuring, and it's also encouraging as well.
Great answers. Dr. Uribe, if you'd like to go, and then Dr. Hamid.
Sure, I would add donuts and glazed donuts particularly. No, I think, talking from experience, I didn't do the best on my Step 1. And, those are hardworking years that you have to work in your third and your fourth year. Definitely acing all your sub-Is, all your clinical rotations. And then, of course, rocking your emergency medicine rotation as well, any away rotations that you may have had the opportunity to perform in. Personality is what's going to get you, if you're based out of a 5, it's going to get you at least to stage 3. And then the overall application, just like Lord mentioned, if you're interested in community health or extracurricular activities, if you have a stellar personal statement, and just overall, and then obviously you have to have a discussion with yourself and see, should I take Step 2 and should I take it early just so that I can have it, shown that I've improved?
I like improvement. Improvement makes a lot of sense. Dr. Hamid?
Yeah, so the Step 1 score, we all recognize standardized tests and the biases with standardized tests. So I don't think that we focus very, very highly on those scores. If you're doing very well, that's a plus, but if you're not doing very well, it does not absolutely count you out. What we're looking for is a good fit for the program. So every program, as you interview, you'll notice that there's a different feel, a different vibe for every program. We're looking for the right vibe, the right student to come to our program and feel like they'll fit in. I did my away rotation here and actually did 3 emergency medicine rotations, and I was told on a couple of occasions about this 3 a.m. test. And what's that? That's whether or not I can see myself sitting next to you at 3 a.m., us working a shift together. Can I stand you at 3 a.m.? So attitude is definitely what you want to focus on. Be upbeat, not too upbeat, but be upbeat, have a positive attitude. We really are looking for you to follow directions. Okay, if you're going to see a patient, we ask you to do something, follow up with it, and I think that will carry you very far. But it's mostly attitude is what I think.
I like that. And the 3 a.m. test is real. It's not a joke. We've all done it. We've all seen it. So make sure, students, you pay attention to how you're acting around 2, 3 a.m. All right. This question is for a tip for all of those fourth years who have secured an away rotation and they're lucky they get to go somewhere or even rotate in their own program. What skills do you feel every fourth year should have during their away rotation? For example, suturing, charting, typing, Foley's, IVs, whatever you think is great. And we will start with Dr. Hamid first.
Yeah, so your goal being a fourth year medical student on your audition rotation, or this year your possibly your only rotation, is to, to do well enough where, so as an attending, as a medical student, I didn't really understand this, but as an attending, it's a little bit of extra work to work with a student, right? The knowledge base isn't as high as if you're with a PGY 2 or 3 or something like that. And that's fine. We love to teach. That's why we're in academic medicine. But knowing where the IND tray is, knowing what you need to do an IND takes you very far. Asking the nurse to grab the lidocaine after it's ordered takes you very far. Just staying on top of the things that probably need to be done next, and getting them done without having to be asked or kind of guided to the room where all the supplies are, et cetera, so forth, I think would really help on your rotation.
Great question. Know where things are, including the bathroom. Dr. Lord, if you would like to drop any hints for what you think fourth years should be doing well when they arrive for their away rotations.
Yeah, I think a lot of the procedure stuff that we can teach. I think one of the things that I find as as it was mentioned in terms of just having a differential and also having a plan, and I think just putting that on paper and just sticking with it. I think sometimes we get a presentation and it's just bits and pieces, or it's just too much. And I think having that communication in terms of what you're thinking helps the attendings know where you are and how we could improve, and also having a plan so that way we can tell you, oh yeah, that sounds good, that doesn't sound good. And I think also just emphasizing being a team player. There are a lot of little things that help the team. Noticing the blood pressure is decreasing, helping the nurses with the IVs, all the little things that that are maybe overlooked. It shows that you're part of a team and you're contributing in a meaningful way. But I think though, just having the ability to present is really, it's that communication skill helps the attending know exactly what's going on with the patient, and it also provides confidence in you. The other thing too, it is the way we communicate kind of what we're thinking and our understanding of what the pathophysiology is going on as well. So again, a good differential, a good plan, essential, and then helping out as a teammate.
Great. Dr. Uribe, do you have any points for the fourth years?
Yeah, donuts again. I'm just kidding. I think a big portion is people skills. Something you learn you learn during your third and your fourth year is a team player, and you don't necessarily understand that until you're a resident and attending. Learning to work with the nurses, the secretaries, other attending residents. There are going to be people that are not on the best side because they haven't had their coffee and donuts, and they're a little irritated. And learning how to work with those colleagues. The same time having patience, for certain staff members or patients for that matter. And we want to, see students that are at their best, that are, willing to help. If there's a call bell and everyone seems to be busy, that you're there to help that patient, whether it's yours or not, and say, oh, this person has to go to the bathroom. Can I help them? Yes, of course. Or this person is asking for a blanket. Go out of your way to get that blanket. When, when I work with students, I do two things. I either tell them, go see this patient, and that's going to be your patient, or depending on how busy it is, see this patient, write a note, send it to me. We'll have a discussion so that I can teach you what's the best way to write, your differential. Or there might be cases during certain busy day of the week or time of the day where we're just like, hey, can you go see this patient? Come back, give me your differential. What's your thoughts? And we'll skip to the next patient so you can go see this patient. Or, hey, there's a lack here and there's a lack here. Can you take care of this? And we're testing you in every way possible. And so having that overall those overall skills is what's important. Ultimately, you want to strive not just for the 4th year, you want to strive as an intern, and then that's how we'll remember you. And also try to be remembered, at the end of when we're going through the charts, we want to be, who is that again? And why is he or she important?
I will
I
say
just want to
right now.
piggyback. Go ahead.
Go ahead.
Sorry.
Go ahead.
I just want to piggyback off of what both of you have said, specifically as far as like gathering information and presentations. So the assessment and plan, if you get that down, that's absolutely fantastic. But I think as a medical student, to not come back with the accurate history or physical exam, accurate enough, I think is a red flag. So if the patient has chest pain and you haven't asked if it's exertional, if it's pleuritic, when did it start? Was it sudden onset? All those things that you learn in medical school, that mnemonic, to come back without that information, it raises an eyebrow, and it takes you from being a 100, a top 10% student, it tanks you down. So just make sure you are able to gather a history, do a thorough exam. If the patient has back pain, you're telling me they have no red flags for cauda equina, but you haven't done a neurologic exam. That's, an eyebrow raise again, and it will knock you down. So I think to be a good, top 1/3 medical student, middle to top 1/3, accurate history, did a physical exam that was thorough, and then assessment and plan is only going to take you up from there.
I would also piggyback, because I think this is one of the most important questions to help medical students shine during the rotation. And that's if we give you one patient that clearly needs a line and you're comfortable, and you've done many lines, by all means, work with the nurse to get the lines and the appropriate laboratory work that needs to be done. A big, skill that you'll develop during residency is ultrasound. And if you have the opportunity to learn a little bit about that, or had already an ultrasound rotation, and we send you for a person that has flank pain, whether they're elderly or young, go and give it a try. We understand that you may not understand what you're looking at, but if you, just by trying, that speaks volume of yourself.
Those are great points. Along with those points, hopefully, again, med students, you're taking notes. And for all the giants we have here in EM and in the comment section and participants, I 100% on EM Med Twitter expect to see #donuts trending tomorrow. So all of y'all just be ready about it. That's the one thing I think we can get going from this panel. Another big question. This is, I think, a great question for those who think they're doing well. And we'll start with Dr. Uribe. What is something you've seen a good candidate do that made them fall off of the rank list? For example, they yelled at the secretary, they forgot the donuts, or a bad letter of recommendation. So what's something you've seen someone with the 250 that nearly solved cancer, but for some reason didn't make it to the rank list?
I think it all goes back to being that team player for me. There's many things that, you can be a stellar on paper, but when you're working with us, if you don't show that you're interested in learning or in teaching us for that matter, because we're all, as a team, we teach each other. If you ignore that patient, or you're yelling at that patient who's requesting help and saying, oh, I'm not your patient, or I'm going to get your nurse, or stop yelling or anything like that. Those are definitely points that, that will easily take you off of my list. And there's one, but I forgot. I think you had mentioned it. I think that's the big one.
All right. Dr. Lord, if you'd like to go next.
Yeah, I think unfortunately, bad slows, could be damaging for you, or mediocre letters of recommendation sometimes take stellar candidates, and we're not quite sure, like everything else looks great, and then we have this letter of recommendation that's kind of soft. I think sometimes, the getting your PNMR doctor that loves you like a brother or sister doesn't really carry as much weight as an emergency medicine physician. So just being aware of that. I think, individuals who have, ortho in terms of their application, and then have EM, just have an explanation as to kind of what made that change, and be prepared to answer some tough questions about that. I think when you're not prepared about why you made the switch from, ortho to emergency medicine, sometimes it may raise more questions, and we understand that medical students, sometimes it's difficult to decide. And then again, bad interactions, right? If you treat my favorite nurse as bad on a rotation, that's a bad thing. All right, you treat my unit secretary who helps me out all the time, that's a red flag, and I think that's also important. And then also just inconsistencies. I've seen, patients who are, applicants who are stellar on paper, and then just to kind of like boring or don't bring much flavor. And so it's really important to have that story and stick to it, have some anecdotes that you want to tell or whatever when it gets a little bit dry. And I think just being prepared overall helps to avoid those red flags.
Thank you. Dr. Hamid?
Yeah, I piggyback off of everything everyone just said, but the attitude, I think, is one of the biggest things. If you're rude, if you're arrogant, overly cocky, overly confident, if you are disinterested, if you seem like you can't take feedback, those are all very big red flags. And I'm telling you, there will be an email sent about you to leadership, and they'll say, hey, the student's rotating, just to let you know, this is what I saw on shift. Because, you know, when we are signing, you know, when we sign up or when we rank you, you're ranking us, and then we'll be with you for 4 years. So we want to make sure your attitude is fits with our program. Another thing that's a big red flag is if on your emergency medicine rotation, you sat in the room with a very sick patient and didn't come get anyone. So if you have someone that, you know, obviously is having an acute stroke, please don't sit there and continue to take the history. Let someone know. Step out of the room, okay? You'll be surprised. So step out of the room and come get someone at all times if anyone looks sick. And then, like Dr. Lord said, if your letter of recommendation, we're expecting to have a strong letter from you, everything's looking good, but the letter of recommendation is a little bit dry and lacking, that's a bit of a red flag. And then lastly, particularly at our institution, we are a mission-driven hospital. So we take care of all the patients in the Chicagoland area regardless of their ability to pay. We take a lot of pride in that. And we are not here to learn off of our patients. We're learning from our patients, and it's a privilege. So anything that seems like you're not interested in serving this particular patient population, or you're just here for the trauma or the action, you know, to learn off of our patients, then that's a red flag, and that's definitely noted.
Thank you. I will step away as a moderator for 2 seconds, and I remind all the medical students I teach this. We see chest pain and abdominal pain 100 times more than we see gunshot wounds. So being sure that you're willing to take care of people in all phases of life. It's not just about the trauma and everything else.
Yeah, and I can actually piggyback on that one too. I think also knowing the personality of the program you're applying to. There's some programs that are very, very research heavy. There's some that's more community, based. There's some that are, have different personalities. And so if you're interviewing for one program, it may be a slightly different interview than it is for another program, and just keeping that in mind. And that's about being prepared and doing your research about the things that those programs value. So just keep that in mind.
Very important.
Also, I would just add, yeah, you may seem like a great applicant now, and then once you do the virtual interview, I think showing interest, asking questions, talking with the residents, especially now since we're not necessarily rotating at other locations, or you don't have the ability to come to the institute to interview, which a lot of the times we were able to tell, this person's a little strange, or this person's very interested, and they ask a lot of questions, and they kind of already matched here, so to speak. So showing interest that even when you're interviewed, you can tell that a person is excited versus, okay, yeah, no, thank you, all my questions have been done, and nice to meet you, type of thing.
So we strive for realness, and like I said, for the last 20 minutes, we'll be taking all student questions. So students, go ahead and try to fill up the chat box or the Q&A, because again, we have program directors, assistant program directors, and high-ranking faculty here. We're going to get to your questions. With the last question from me before we get to those is again one of those real questions. So to our panelists, do you believe in backup plans? Do you think students should have them? Why or why not? We know not every student's the same applicant. So if you were talking to your mentee one-on-one, what's the advice you would give them? And Dr. Uribe, we'll start with you if you don't mind.
I think it depends on your overall package. And I think there's a lot of mentors out there that can have a real talk with you and tell you kind of where you would fall in. I've been told, when I was applying to have a backup, I was also told that, hey, you want to become an emergency medicine physician, you will become an emergency medicine physician. But that doesn't mean that you're going to be, going to residency in New York City. You might end up in the middle of the Midwest, which is nothing wrong with that, or somewhere in a nation that's very far and rural. And so you have to ask your question if it's necessary because of my scores and because of my slowies, whether I should have a backup. And at the same time, keep in mind that this is something that you're going to practice in for the rest of your life. Are you willing to, not match this year and then reapply next year just because emergency medicine is truly what you want? Initially when I went through the process, I told myself, no, I'm going to apply emergency medicine physician, but I've spoken with many medical students who are doing that more commonly these days. And I think it is appropriate to have a backup plan. And, it's to your discretion whether you want to bring that up with your mentors or during the interview process. And I think just being, realistic, I think is also important.
Great. Dr. Hamid, I'll go to you next, and then we'll end with Dr. Lord on that question.
So I think the question that I would ask my mentee is, do you live for EM? How bad do you want it? If you're just interested in emergency medicine, you don't see yourself doing anything else, you would never want to do anything else, then go big, go home, apply to as many programs as you can. If you feel like your application is not that strong, within reason, you don't want to spend a bunch of your money. But if you feel like your application is not that strong, definitely apply to, your top programs, apply to these backup emergency medicine programs that you would still be interested in going to. And if you don't get it that first year round, make sure you have a plan of what you're going to do to strengthen your application in the meantime until the next application cycle. But if you don't eat, live, breathe, sleep emergency medicine, you can see yourself also doing family medicine or something like that, then sure, go ahead. Go ahead and apply to emergency medicine, apply to family medicine as a backup.
All right, and Dr. Lord?
Yeah, I think you should, I think I would describe it more plan A, plan B, plan C, plan D. And I think this is your life and your career. And there's a small window of opportunity that by which to really make that connection from, medical student to EM resident. So I think number one is, talking to people who have been on the other side, who understand, what your application looks like. So looking at your step scores, your overall transcript, and getting some honest feedback, and not just from your people but from people you don't know. So reach out to other people and kind of get that vetted. And then also thinking, again, you may have to apply to a lot of programs. And some of them may be, not your first, second, third, or fourth choice, but like you said, if emergency medicine is in your blood, you're trying to get trained. You're thinking about the next, 30 years of your career, not the next 4 or 3. And I think that's a big difference between the two. Also, thinking about what to do if you don't match. I've seen a lot of people, not have a plan in case things don't work out, and that causes, they used to call it the scramble because you really were scrambling. And I think you don't want to be in a situation where if things don't work out, you don't have a plan. You want to have that third, fourth tertiary plan going forward. And so I think, yes, you should have different A, B, C options regarding just based off of how your profile is from your application.
That is important. In emergency medicine, we always have a plan. If the adenosine doesn't work, what are you reaching for next? Electricity, other drugs? We got to have plans. We don't stick on one. All right, we are full on student question mode now. So any question can be answered by our chat moderators. You guys have been doing an excellent job because I know I've seen at least 100 questions go by, so thanks. You guys can keep answering those, chat moderators, and we'll even answer some of them on screen. So the first one I loved, because this is a question, I'm not gonna lie, I didn't look into. What are the differences or big differences between a 3-year program and a 4-year program? The joke out in the EM world is $250,000, but I'm sure you guys have better answers than that. So Dr. Hamid, I'll start with you, and then we'll go Dr. Lord and Dr. Uribe.
So I went to a 4-year program. I trained at Cook County, and we are a 4-year program. So we get this question a lot, and usually the answer is you have that 4th year to really develop your niche. However, over the last year, we're kind of revamping the way we deliver residency. So we used to have intern year, you didn't really get into the resuscitation bay, you didn't really see critical patients. We're mixing it up this year, and we're letting residency patients a little earlier, critical patients a little earlier. In that 4th year, you're really able to dive into whatever type of elective you're interested in. For example, I was interested in EMS, and I did a fellowship out in Denver, Colorado. So I was able to kind of focus on that. I was also able to focus on things that I wasn't that strong at, such as reading EKGs. As a fourth-year resident, I got a STEMI equivalent, and I didn't recognize it was a STEMI, you know, and it was like De Winter's pattern. Anyway, I was graduating in, 4 or 5 months, and I said, well, this is scary. So I actually did a rotation up in the cardiac ICU in order to hone my EKG reading skills, and read an EKG with the cardiac attendant every single day on rounds, every single patient. So with that 4th year, you're able to have that flexibility to work on things, to get into research, focus on what your interests are, and you probably wouldn't have as much time to do that with a 3-year program.
And before you go, Dr. Lord, I got to do a little moderator thing. Thank you for joining us, Dr. Dreyfus. If you don't mind just introducing yourself to everybody. We understand things happen. So just introduce yourself, where you are. No problem.
Yeah.
Introduce yourself.
Sorry. My name is Andrea Dreyfus. I am faculty at Highland Hospital in Oakland, California. And I apologize. I thought it was 5 p.m. Pacific time, and that's what I had in my calendar. So I'm glad I caught towards the end. I'm Peruvian, born and raised, and immigrated here when I was 20 years old. So for some of you guys that might have started med school in another country, that's a little bit of my story. I had to restart everything. And also I have a passion for global health. I'm also ultrasound fellowship trained. So I'm also the ultrasound global health director for Highland Hospital. And I started an organization called Ondas de Latino America, where we started the first Peruvian ultrasound fellowship. We're now about to graduate our 2nd class. So that's me. Sorry, I'm late again.
Oh, thank you. And Dr. Lord, I'll let you get back to the question, the difference between a 3-year and a 4-year program.
This is an ongoing debate in the middle of the, a lot of contention. I mean, honestly, in the big scheme of things, when you think about a 30-year career, it doesn't make a difference, right? I mean, 3 versus 4. I think, I did a 4-year program, and I taught at two 3-year programs, and I haven't seen a difference regarding the trainees. I think there's an advantage, though, in terms of, like you said, having elective time, especially thinking about doing academics. I had a chance to go to Liberia, spend time over there. I did an administration fellowship afterwards, and I was able to build those connections prior to that time. So I think there's some benefit to the 4-year program. I have no regrets for doing that extra year. I think if you're thinking, pure community, going to the community, for instance, and not doing academics, that's a slightly different question. Do you need that extra $250,000 year? And that's something that I talk to my mentees a lot about in terms of, is it worth it? And I think it's more of a personal decision. But overall, the 3 versus 4, you're not going to see much of a difference. There's maybe some slight differences, but nothing that's major. And in a 30-year career, it doesn't make a difference.
All right, Dr. Uribe, I'll let you chime in there, and then we'll move on to our next question.
It's a good question. And we get it all the time. And I think my biggest recommendation is kind of where do you see yourself after residency? If 75 to 80% of residents go out into the community. So if you see yourself just wanting to work emergency medicine and that's it, then perhaps a 3-year program might be for you. If you don't know what you want to do after residency, whether you see yourself being part of admin, being part of a core faculty, or developing a niche, which is the direction that we all should be going. We should have a niche in emergency department, whether your niche is, hey, I'm the neuro guy. Any questions you have on neuro, you can ask me because I'm up to date and I love that. Or whether it's OBGYN related, or whether it's cardiac. I love reading EKGs, and I'm on top of Mama too, and that's who I am. And so having that opportunity to develop your niche in a 4-year program, because it can be hard in a 3-year program, allows you to do that. If you're interested in fellowship and I want to do XYZ fellowship, then maybe perhaps a 3-year jumping into a fellowship is the right way to go. If you don't know that whether you want to do a fellowship or not, then maybe having that 4-year program where you develop that niche where you're able to publish and work on stuff. And you'll see that in the direction that you're going in a 4-year program, you can be the ultrasound resident and you can develop a ultrasound program. And then when you apply for residency and you want to work out in a community, you can actually be the ultrasound director because you've had the opportunity to develop that niche while you're in residency. And so those are the recommendations that I give.
All right. So we're going to go to our next question. And Dr. Dreyfus, I'll let you answer the question first. Our next question again comes from a student. How should applicants approach asking difficult questions, especially issues of diversity or lack of thereof? And in the chat, I'd like to combine them with questions about jobs in the job market. So how should fourth-year students currently ask programs about difficult issues like diversity and the job market?
I think you should be honest. I think well, let's first address if you're a med student looking into residency, right? I'm sure I missed some of our has already been probably discussed, but you are interviewing us as much as we are interviewing you. This is a match. It only works if you like each other. So just be honest. It doesn't matter like how prestigious a program is. It's really like, would you love to spend 3 years with your colleagues and those patients, or 4 years, which Highland is. And you know, residency is tough. You want to be at a place that you feel happy, the happiest. And I think if diversity is very important to you, which I assume it is for all of us, that's something very crucial, right? So I don't ask only the program directors who hopefully they are not going to give you a scripted answer, but you know, it's a little bit tricky because that's their job, but ask the residents, ask the other people of minorities or colors that you might connect with. Like, and I would just be very like, hey, you know, for me, like I am, you know, Latina and I want to work with that patient population. I want to speak Spanish. What percentage of like the time are you speaking Spanish, or you know, I'm African American and I want to care for that population. This is very important to me. And I think we are going to love that questions that are coming honest. That's also going to let us think, are you a good fit for our program? If you're, you know, mostly at Highland, I work at a county hospital. We're mostly seeing, you know, minorities of our patients. And so we want people that actually have a passion for caring for that patient population.
Great answer. Dr. Hamid, if you would like to chime in on anything there on how students should ask the difficult questions.
Yeah, I piggyback off of what Dr. Dreyfus said. I would ask the residents, especially those that you identify with, and just ask if they feel comfortable there. And they should be able to share with you how they feel. Usually the residents are pretty candid. I would challenge you to also ask the faculty during your interview. If you get a response that's very off-putting, I think it's safe to assume that, you know, that program may not be the best fit for you. And I think that that's the best test right there. But I think that you can frame the question in a respectable way, and I think you can get the answer that you're looking for.
Great question. I'm going to try to maximize all the questions I see coming in. So I may just do 2 instead of all 3. So I will have Dr. Laura and Dr. Uribe answer this question next. I have personal knowledge after looking through our registration list that there are a few postgraduates in the chat, and they are still members of LMSA and SNMA. They're still part of our family. So do you or anyone in the chat have any, I guess, advice for people who may have had to SOAP last year and are applying into EM again this year to spruce up their application in their process? And whichever one of you guys would like to go first is fine.
I mean, I think sometimes when I think looking at a lot of applications, a lot of people applying, sometimes you're making blind decisions. And I think it's really important, extremely important, to find a mentor who you could trust, who could help guide and navigate and help figure out what's best for you. And I've seen a lot of mistakes that people sometimes make in terms of trying to do it themselves or not having somebody that's advocating for them. I think every situation is slightly different, but finding some mentorship. I will give you an example. I reached out to Rob Gore 12 years ago. I found his name on a website. I didn't know him at all. I literally just emailed him out the blue. And next thing you know, I was rotating with him and he was helping me out and helping to shape my career. So, you know, I did not know this man at all. I just, you know, I figured I should give it a shot. So he was able to mentor me going forward. I would encourage you guys, especially these academic programs, to find somebody, email, ask questions, and then, you know, curtail whatever advice is for you individually as opposed to the, you know, blanket statement.
Lots of shout out for Rob Gore in the comment section. I love it. Dr. Uribe, if you have any advice.
Can you repeat the question because you broke up on my my computer.
Oh, sorry. Do you or anyone else have any advice for students who graduated last year and had to soap into a different specialty who are reapplying to EM this year?
Yeah, that's it's very hard. But I think you know, telling your story and demonstrating how emergency medicine is for you, or whether you ended up going into surgery or any other specialty and you learned, hey, this is actually not for me. Having that story, if you are able to, while you're in residency, do a rotation in the emergency department will help. And then obviously, you, just like a medical student, you have to shine and demonstrate that you are a great person and not, you know, this intern that thinks he knows it all because he's a family medicine, internal medicine, or a surgery, or a surgeon. For those that had to take the year off, or not take the year off, but do research or perhaps take a master's that are reapplying, you know, you have to demonstrate what is different in your application. How are you different from the original pool of students that are graduating and that are now applying? And then I think, just like Lord mentioned, you know, a lot of times these days is who you know, is what connections you have, and having that mentor or having that one person reach out to the program director of that program and be like, hey, I know XYZ student or resident. This person, you know, really knows their stuff and is really interested. Take a look at their application, and if you have any questions, reach out to me and stuff like that. So,
and I just want to make one more comment too. There are a lot of new programs out there that don't go through the match, and so just be aware that those ones, you know, may be looking for applicants. So if they are looking for applicants, they fill up very quickly. So you have to stay on top of it. So again, if there's a new program out there, have your application ready, make those phone calls, you know, make that drive if you have to, but you have to show that initiative.
also, I would add, there are spots that open up in the middle of the year because the student just happened to, you know, leave the program for whatever reason, just like perhaps you may be leaving your program. So look out for those and then reach out to them early.
This is for all of the panelists, but I'd like to start with Dr. Hamid and Dr. Dreyfus first. When should students do the reaching out to programs, especially during this application process? If applications are due, you know, September 15th, should they be emailing program directors the 16th? Should they wait till Christmas, Thanksgiving? What is your point that you usually tell students, hey, don't contact us until X? Dr. Hamid, we'll start with you and then Dr. Dreyfus.
So I think this is a great question for our program director because I don't really receive the emails, but I know that when our students complete their rotation, they usually send an email sometime, you know, a couple months into application season, right when the application season opens, just to remind us that they're there, you know, and that they came by and that they're interested. And then some, you know, some months later, they'll send a follow-up. As far as our program director, I've, you know, heard him say on several occasions that you don't need to email at all. We've got your name, you know, and we know if you did a rotation with us, we definitely remember you. And if you didn't, you know, we're doing our best to give the application or give interview spots to those who we felt were ranking or who we felt that were like higher up on the list. That sounds bad, but higher up on the list, we're giving those spots out. So if we're able to offer a spot, we'll offer you one as soon as possible. But he usually doesn't ask for emails or request those emails. Otherwise, his inbox would be full all day with a bunch of emails. We get thousands of applications.
Dr. Dreyfus, go ahead. And while she's talking, participants look in the chat. You got two program directors giving you exact dates. Circle those.
Yeah, so it's probably very program dependent. I know at Highland, we don't invite for interviews until I want to say October 1st, maybe October 15th. So anything before that, a decision hasn't yet been made. So I would definitely hold off. I think I see on the chat, I think some people are talking November, some people are talking late October. You know, if you know the program and you've rotated there, that's easier. You can ask around, but I would just give it a little time. It does take quite some time to read, you know, 600, 800 applications and decide who should come or not. And I think once interviews are going out and, you know, perhaps you're on a wait list or you're not invited to a program that you really like, that's exactly the time that you want to reach out. And that's similar to when we talked about SOAP, reaching out through perhaps a mentor that might have a connection can be very powerful because, again, it has to be a mentor that knows you. This is very important, not just somebody that has power, but somebody that can actually advocate for you can go a long way. But again, if you're like most of us, just normal and a social, happy human being, you can also reach out. I know our program directors get those emails and then they have to make decisions. And often we do invite some other applicants that perhaps were not invited initially.
I can comment too. I think too, there are a lot of people on the interviewing team besides the program director who have less emails, and so just be aware that, sometimes going for the program director, you may not get a response, but there are a lot of other people who are involved in the residency program, and just, targeting them sometimes may get better responses than targeting the program director on a consistent basis. The other thing too is once you start with email change, you kind of have to follow up. So just be aware. So, put it on your calendar in terms of following up with this particular person or another particular person. Because it's, you say, I loved your program so much, and then you don't hear anything from them ever again, or they want to connect about something, I would love to get some more mentorship on XYZ, and then they never follow up. It's a red flag. But again, strategically think about it. Don't just target the program director, target other individuals, and you'll probably get a higher yield.
So real quick, at 6:59, I'm not going anywhere. If anyone wants to stick around for another 15, 30 minutes, that's fine with me. Two things in case anyone does have to leave. One, I know literally starting in 1 minute, there's a fundamentals of the EM application process, an ADIEM webinar series. It has basically all the big names in EM, SAEM, ADIEM, AAEM, so on, CORD, and so forth. So if anyone goes there, I completely understand. Secondly, before you leave, if anyone noticed, the password to get in to today's Zoom for the attendees was 110320. That's November 3rd, 2020. That'll be a big day in our country, so make sure to utilize it as best as you can. I will not say anything else further from there. I will go on to our next question. Next question, you will see that Dr. Alvarez, before he had to go, which again, we're at our hour mark, posted a lot of social media links in his account. A lot of students have the question, what should we do when interacting with programs on a social media tip? Should they have burner accounts like Kevin Durant? Should they just erase everything and have an all nice one? Should they change their name? Should they block their names? What are your thoughts? Anybody can go ahead and answer. Oh, no one has any answers? Ooh.
Sorry, the question was regarding applicants and their social media profiles?
Yes, a lot of students are always worried, if I follow Stanford on Instagram, and then they click on my Instagram link and scroll through it and, I'm at the club, does that look bad? If they see me on Facebook and I liked the new WAP video, does that look bad? So, people have these questions.
I would say if you followed a particular program, I would just make sure that your social media, you don't want to be out there doing crazy things, such as, around drug paraphernalia, something like that, in your photos. I think we're all human, we all live our lives, but I would just not have any photos up there that may be taken the wrong way. I just made my social media public because of a talk that I was giving. They were asking that I do that. Anyway, I went through and I deleted a bunch of photos, so I think you can do the same.
I can give you, just because a lot of the people that are in this listening to this panel probably just haven't entered a career in EM yet, but I think it was actually helpful that somebody many years back said that there's a lot of free online medical education, as you know, and a lot of them, I believe Twitter for EM is very, very helpful. So if you guys want to just create one that is your EM professional one, and if you already have a social one, keep that one aside. Just that way, it's a nice way to organize, being like, oh, for this one, I'm learning emergency medicine. This is how I'm connecting professional. And the other one is completely social. I'm only on Twitter for EM purposes, not there socially. And so it's simple for me, but I know a lot of people that joined earlier because of, making friends. So that's just a little recommendation, but I know, I don't think we go and our program, and perhaps some people do, I don't think I go and try to look at people on their Facebooks or Twitters when I'm trying to make a decision. But again, it is public information. So I do know of friends that maybe job related that might have affected. So just be mindful and professional as much as you can.
Yeah, get two accounts. I mean, and separate the two, especially if you're applying. You don't want somebody to make interpretations about you without your ability to actually explain what's going on. And so there's really no advantage, right? So if you're applying for this, curate your page, or keep it private. But there are just so many things that could be misinterpreted by people who may not know you, and you may be already judged before you go to the interview. And just that one bad picture that you get tagged on or what have you could, really, make a big difference. So I would just be careful during the interview process. And then, that's just my personal recommendations.
I would like to point out in the chat, for those who may not read it, Dr. Bradby pointed out something amazing, and I've noticed it too. Some of your names are clearly visible when you've retweeted or liked some things, and it's clear to see that you not only liked something on Twitter, that you're here today. So interacting is a great way. Your name will stand out. You never know. You may be on the interview trail and say, hey, I remember you. You were on Twitter and you have the Avengers hat on in your picture, and maybe that stands out. That's something that you want. You don't want to have you being surrounded by all the Avengers in a fight or something like that, if that looks bad, because that'd make you the villain. Obviously, you're fighting them. Anyways, on to probably the questions in Q&A are slowing down, so I'll probably ask one last one that I saw a while back, and we'll round up. How does wellness look to you at your program? And how would you encourage students to stay well during this application process? As I started off, there is a lot going on in the world right now, and a lot on students' minds. So how would you recommend during the process they stay under control and keeping their mind right and clear? And how would you recommend they do that during residency if they are able to come to your program? And I will start with Dr. Uribe and then Dr. Dreyfus.
I think wellness is a big thing that we're all starting to realize in the world of medicine. And it's not only just during, as attendingship or during residency for that matter. We're trying to push it into the medical school and college realm for everyone to learn the importance of wellness. And a big portion of that is social support, whether you have family, whether you have friends in the area. And when we see someone from the other side of the nation, the US, that's looking to do residency in DC or Maryland, we want to ask those questions, why? Obviously, if that program is for you and that's what you want, you're going to be able to easily explain that. But then at the same time, we might wonder, you're going to be here alone, is that something you're okay with? And we're going to be, and you may be asked, like, what are some ways that you kind of de-stress yourself? In other words, whether that's, working out, whether that's your pet, whether that's, photography, or whether that's playing sports or fitness. And it's important, no matter how busy you are, to continue those aspects of that. And during residency, we always incorporate that both during residency and with the attendings, whether that's making sure that residents have the opportunity to get together, or at least now Zoom meetings for that matter. And having that interaction with the attendings is another aspect of wellness that we're trying to develop.
Yeah, I think wellness, again, is different for every person, but I want to talk about the wellness that maybe sometimes wellness is not like how many shifts you work, how much time off you are, how much money you get for, elective or whatnot. Yes, that is all nice, but it's really how happy you're going to be when you're on your job. Residency takes a lot of time. You're going to be living at that hospital essentially, right? And so really assessing how the residents that you're interacting with when you're in Zoom calls this time around is super important. So like when I interview for residency, I had a 4-month-old. And so for me, it was really important to see how many parents are in each program. Am I going to have to reinvent the wheel and trying to figure out pumping and whatnot? And that was for it's very different for different people. But for me, that was a huge part of my wellness. Highland, specifically about our program, we call it the Highland Family for a reason. It's a small program, but it's a powerful, and we're very, very tight. There's not that many attendings, which makes it that truly they're there for your education. They want to make you the most badass emergency medicine doctor out there. And even though you're going to get amazing training in many places, some of the programs, and it depends on how you learn, you're going to have attendings that you're going to see maybe once a month, and maybe they're not going to really get to know you and know what are your strengths and weaknesses. So it kind of depends a little bit of your niche and how you want to, how you learn, how, what you perhaps think you're going to be interested in after residency, right? Academics or county or clinical. For me, it was very clear that I wanted to become a very strong clinician and also work at a place that I served the community that I went to medical school for. And so it was simple. And I wanted to be the place that I felt were my people. For EM people are going to be all great everywhere. Just find the place where, as mentioned already, you have family, your love. If you have a significant other, that person is going to be happy at that place. Think about friends, think about cost of living, and then also try to see what's the best match for you.
Excellent. So we have about 5 minutes left. What I would like to do is open it up to anyone on the panel. Anything I didn't ask that you want to make sure you get to all of the participants here, both our chat moderators or those on screen. Feel free to take the floor now in the next couple of minutes to get that advice out there.
I think a question that a lot of applicants ask is how can they choose between this program or that program, given that each program is so different, each of them have their different assets. Some of them may have one thing and the other program may not have that thing, but they may have this other great thing. So how can you choose between all of them? And the advice I always give is that after your interview, I would just sit down and write a couple sentences about how you feel. And kind of like the emotional response to that program. And I would use that to drive whether or not you rank that program highly. I think that that's going to tell you a little bit more about, your wellness for the next 4 years, how you'll fit in, how you'll feel working with these people. And I think that's a good way to go about it in my experience.
All right, any other advice?
I think just to piggyback off Dr. Hamid, try to think forward. Where do you see yourself in 3 or 4 years? Is that location-based? Is that fellowship-based? If looking back, if I had known that I wanted to do EMS, then maybe perhaps the best choice would have been to do a fellowship, a residency in a program that had an EMS fellowship or is affiliated with a big EMS system. Or if ultrasound is an interest of you, make sure you're in a program that has an ultrasound fellowship. We talk a lot about looking at the program and see if there's a lot of fellowship trained because it adds that diversity to the program. So looking into things like that. It's funny because the questions I asked for med school when I was in college, when I was in med school, I was like, oh, I asked her all the wrong questions. And the same thing happened, as a resident going into attending or as a medical student going to residency. So think outside of the box and just don't think outside, asking how many traumas do you guys get? How many chest tubes do you get? That's very superficial of what a program can offer you. You're going to become a badass emergency medicine physician in any program that you go to, but who are you going to be that person outside? Once you finish residency, are you going to be that advocate in the community? Are you going to get into public health? Are you going to get into administration? Where do you see yourself? And does that program that you're interested in have those opportunities?
And I can comment too. I think the way that you approach the interviews is also important. I think this was mentioned earlier, but you have a lot to offer. Okay. You have a lot of things to offer. And so it's not just a one-way street. And so it's just really important to think about when you're matching, thinking about the needs of that program and how you fit into that program, and also how that program fits you. And so when you're making your assessment, making sure that it's a mutual beneficial package. And so when you're in your interview, also mention the things that you will bring to the program. I like basketball. If you had 5 Shaquille O'Neals on the team, you wouldn't win, right? And so you need a diversity of different types of people and different types of personality, and you need in different skill sets. And so just keep that in mind when you're thinking about your personal statement and keeping it all together in terms of who you are as a person. And I think that'll help you.
Yeah, I kind of 100% piggyback to that. You want a place, as I mentioned, you're also interviewing us. We want to sell your program, right? And so you want a place where, like, if you're interested in doing a project in an EMS, or if you want to travel overseas, or you're like ultrasound, you want a place that can nurture that. And you can actually, my most favorite interviews is when somebody comes with actually like a plan, not like a very structured, but it's like, I am very passionate about medical school education. And like, I did this in my med school, and like, how do you think I could bring that to Highland? Like, how you guys are affiliated with UCSF, like how much, and that's just an engaging, fun interview instead of like the typical questions, like how many traumas, how many chest tubes. That's, it's so sure. You can just look that up on the website. With that said, you guys are in a very unique year for applications, since you're not going to be visiting us. And so, and I believe most programs are doing this, but I know Highland, they're doing like a monthly seminars where they're inviting panelists like this, where they have residents and faculty talking about some of the interesting, I think we just had one on diversity, or one is coming up, I can't remember. Then there's one of like social emergency medicine and things like that. So you have, nobody's going out and hanging out. So you have a little time, and then those programs that you're interested in, you want to learn more about them, since you won't get to visit, I will encourage you to try to reach for those opportunities and learn more and more in these unique ways. And actually you get to interact with us during those sessions. So it's kind of like, a social pseudo, you're not being interviewed, but I think it's going to mean a lot if we see somebody that attended the seminar, right? And they were interested and engaged. Then in an interview, it's somebody that I'm like, oh, this person, has this interest. So they're out there. I know Stanford also mentioned that they're doing something, and I'm sure a lot of these people in our panel might. You guys are amazing. You're gonna have an amazing career. So just again, show what you're proud of and what you bring to the table.
I did want to add for the personal statement, I do think that, I agree with what everybody said. I do think that it's your one way to sell yourself and to sell what you're about to the program, to get them to invite you for the interview. So you want to make sure it looks like you've put a lot of time in it. Well, actually put a lot of time in it, but it needs to look that way as well. So you can, if you're associated with an academic spot, so they should have a library, and a lot of people don't know this, but the library should have someone that can help you edit papers. So just take your personal statement down to the library, ask someone to help edit the paper for you. They'll look it over, fix your grammar, find some things that you may have overlooked to make sure that your personal statement sounds strong. They can suggest some edits for you. And then it's just to follow up on the social media, I just wanted to make sure I didn't give the impression that my social media was crazy. It's just that I look at my social media as a grandma, like what would my grandma agree with and what wouldn't she agree with? And if she wouldn't agree with that, let's delete that. And my friend commented, that was kind of a weird comment. I'm just gonna delete that. So I just wanted to follow up on there.
Thank you very much. I just put in the comments.
One thing that I forgot to mention.
Go ahead.
One thing that I forgot to mention last time that I forgot was, it might not play a role now as we're not rotating, but if you did have the opportunity to rotate in an emergency department, is the thing that will definitely throw you out of the rank list is throwing people under the bus, whether that's another medical student, whether that's working with a resident, or whether that's with the nurse or anything like that. That's a big no-no. I think in general, and it's own up to it if it's your error, or just stay quiet and say you don't know.
That's great advice. Right now, I'm already getting the messages to start wrapping it up. So a few things as I wrap it up. Thank you to all of our panelists. I really appreciate your time and energy again during this stressful time. If you would like, you can put your chat in the chat group. That would go out to about 34 people. But if you would not like, you can again just email me if you'd like to share your information with anyone that reaches out, and I will. For the participants, again, you already have my email. I'm the guy behind the love@tourfordiversity.org. You can email me and I will try to connect you with any of our panelists or information that you'd like. I am going to wrap up with one of the things we love to do at Tour for Diversity, and that is to tell our story. Stories matter, and we think getting out there is probably the best motivation we've done. I went to a medical school that did not have a home EM program. I failed step 1 the first time. And I had to apply to over 80 EM programs. That's a lot, and that was a lot of money, but I matched and I'm here now. That is my story. I hope that's not your story. It's a lot of programs, a lot of money, and a lot of work, but I got with mentors that helped crafted my story to make sure there was at least one program in America that wanted me, and I got to go there. Again, Central Michigan, CMU, tough enough. That is our tag, and I got to go there. So please, don't give up on your dream, fight, get with your mentors. It's not looking good around November, December, re-up, get something else to think about, but you can do it. You've made it this far. Thank you to everybody again. I will turn off my camera and mute myself just so you guys can copy anything you see in the chat, and I'll be closing down the meeting room in about 1 to 2 minutes. Thank you again.